Welcome to this explainer. Today, we're exploring a truly radical and honestly fascinating medical experiment. We're breaking down a documentary that follows Dr. Chris van Tulleken as he tries to do something pretty much unheard of in modern medicine, run a completely drug-free clinic right inside a busy London GP surgery. We're going to look at how he takes patients dealing with severe chronic pain, deep depression, and life-threatening metabolic conditions and tries to actually cure them without using a single pharmaceutical. Okay, let's dive right into this. To understand why a doctor would even want to completely stop prescribing medication, we really have to look at the massive scale of the problem. 1 billion. That is the staggering number of prescriptions handed out in the UK every single year. When you break that down, it equates to over 15 courses of medicine for every man, woman, and child in the country. The documentary frames this not just as normal medical treatment, but as an absolute public health crisis of overprescription. And, while drugs absolutely save lives, this massive binge on medicines is leading to a dangerous rise in severe side effects, dependencies, and, even fatalities. So, here is our roadmap for today's explainer. First, the overprescription epidemic. Second, treating depression with cold water. Third, kung fu for chronic pain. Fourth, walking away from diabetes. Fifth, the influence of big pharma. And finally, redesigning healthcare. Let's get into it. Starting with Section 1, the overprescription epidemic. Diagnosing the crisis of quick-fix pills. So get this. In just 14 years, prescription rates have shot up by over 50%. Patients walk into their doctor's office, and they're basically expecting a pill, an injection, or an operation. We've kind of been conditioned to expect this immediate chemical solution to incredibly complex biological and psychological problems. Notice the stark contrast here. On the one hand, traditional treatment offers those quick-fix pills, but comes heavily burdened with severe side effects for a patient who is basically just passively taking them. On the other hand, we have Dr. Chris's proposed drug-free interventions. These require major lifestyle changes and, frankly, hard work through supported active therapies that treat the root cause rather than just masking the symptoms. It's demanding, for sure, but as we'll see, it's incredibly rewarding. Moving right along to Section 2, treating depression with cold water. Sarah's 13-degree shock to the system. In the documentary, Dr. Chris introduces us to Sarah. She's a 24-year-old who has been taking antidepressants for 8 years, feels totally numb, and just wants her life back. His radical prescription? Swapping her daily pills for cold water swimming. Now, what's really interesting here is how Sarah, and literally millions of people like her, end up on these medications in the first place. The standard tool used globally to diagnose depression is the PHQ-9 questionnaire. But shockingly, the film reports this was actually developed by a pharmaceutical company. It contains absolutely zero positive life questions. It basically forces the patient to focus entirely on their misery, which the documentary argues actively drives up those antidepressant prescriptions. So what actually happened when Sarah ditched the pills for a freezing 13-degree lake? Well, it wasn't easy. Initially, she panicked and couldn't even swim more than 50 meters. But Dr. Chris realized she didn't just need the water, she needed support. So he hired a swimming coach. And with that guided support, her transition from total panic to absolute euphoria was incredible. Listen to this quote from her. "I find that if I do have a low with anything, I find if I come here, it solves it straight away." She went from taking daily antidepressants to completing these euphoric, kilometer-long, medicine-free swims. These real lifestyle changes reorganized her entire world. Which brings us to Section 3, Kung Fu for chronic pain. Crystal's battle against opioids. Let's put a human face to this data. 36-year-old Crystal has been trapped in her flat with severe, unexplained chronic pain for 3 years. She's completely unable to work, and she's relying on a literal shopping bag of medication. Look at this daily intake. 16 codeine pills, which remember is a drug related to morphine, tramadol taken 3 times a day. And because opioids cause awful side effects like extreme nausea and constipation, she takes even more pills just to combat her painkillers, totaling roughly 30 pills every single day. And the craziest part? She was still in agonizing pain. The pills were merely masking the issue while slowly shutting her body down. To help her get her life back, Dr. Chris had to design a pretty grueling roadmap. Step 1 was supervised tapering. Basically slowly reducing her opioid intake with the help of a top pain consultant. Step 2 was managing the severe withdrawal. Crystal went through insomnia, intense pain flare-ups, and severe physical sickness as her body craved the drugs. And finally, Step 3, Kung Fu conditioning. He paired her with a master of martial arts. Now, the goal wasn't combat. It was about using slow, mindful movements to rebuild her atrophied muscles, and crucially, to teach her brain to accept the pain rather than constantly panicking over it. And you know what? It worked. Months later, Crystal was off her heavy painkillers, standing tall, and actually smiling. All right, moving to Section 4, walking away from diabetes. Mike's 8-week structured experiment. Meet Mike. He's 69 years old, a generally active guy, yet he takes 10 pills a day purely as preventative measures against high cholesterol and type 2 diabetes. To explain what's going on here, the documentary introduces a fascinating concept from Professor Samir Gray called walking deficiency syndrome. The core argument here is that a lot of patients aren't inherently diseased. Instead, they're simply suffering the biological consequences of our modern hyper-sedentary environments. And tragically, the medical system unnecessarily treats this with chronic daily medication rather than actually funding and supporting a structured walking program. And this brilliantly illustrates exactly what happens when you treat the root cause. Dr. Chris took a group of patients off their statins and led them on a structured walking program, just 30 minutes, 5 days a week. Check out these 8-week results. Mike's HbA1c, which is a key diabetes marker, plummeted from a dangerous 75 way down to 57. Janet's dropped from 56 to 48, pulling her right to the edge of reversing her diabetes entirely. And overall mood scores in the whole group shot up from 37 all the way to 51. These are miraculous, life-changing results achieved entirely without a single drug. Let's zoom out a bit for Section 5, the influence of Big Pharma, the hidden hand in your doctor's office. So this raises a huge question. If lifestyle interventions are literal miracle cures, why aren't they the default? Well, Dr. Chris investigates this deeply ingrained culture at GP surgeries, where representatives from the pharmaceutical industry regularly buy upmarket lunches for doctors during their clinical meetings. Now, while doctors generally insist it doesn't affect their prescribing habits, the research proves otherwise. Looking at this practice bluntly, Dr. Chris is pretty outraged, stating, "It's a bribe. It's a simple bribe. It's a subtle way to ensure specific drug brands stay top of mind the second that doctor reaches for their prescription pad." And to anchor this documentary's findings in some hard data, look at this incredible number, $13 billion. That is the amount in financial penalties the pharmaceutical industry has paid in the U.S. alone in recent years for unethical behavior, which includes bribing doctors to prescribe their drugs. This staggering figure really shows that the push for a pill-heavy medical system isn't just some accident of science. It is a massively profitable, multi-billion-dollar business model. Finally, Section 6. Redesigning our healthcare system, moving from passive prescriptions to active support. The absolutely crucial takeaway from this whole drug-free clinic experiment is that lifestyle changes only work when the healthcare system actively supports patients through the hard work. You can't just hand someone a flyer about a structured walking program or tell them to go swim and expect them to succeed. They need coaches. They need structure. So I want to leave you with this final provocative thought. If a daily walk, a cold swim, or guided martial arts can act as a miracle cure, literally cutting diabetes markers, easing chronic pain, and lifting deep depression, why is our healthcare system currently only paying for pills? It really challenges us to reconsider our relationship with quick fixes, doesn't it? Thank you so much for joining me for this